So today we have this problem with a patient who received anti-CD19 CAR-T cells for their large B-cell lymphoma, that we have a fraction of a patient who will achieve a partial response or less than a partial response at 6 months after the infusion. So a response in this case is assessed by means of a CT PET scan. And we don't know how to interpret this data in the majority of cases. In fact, there are many colleagues that are suggesting always performing a biopsy in order to confirm a real presence of disease for this patient. And also today we are assisting to other methodologies such as liquid biopsy that eventually could help us in confirming if a patient has a real persistence of disease exceeding 6 months after the infusion of CAR-T cells. Of course, this represents a problem because if you look at the data from the studies that have been published right now, most of the patients achieving a response, a partial or a complete response after CAR-T cell infusion are having that response within the first 3 months from infusion. So when you are at 6 months, if you have seen a patient with less than a partial response, you have a strong doubt that that patient probably has failed also the therapy to CAR-T cell therapy. But of course, the point is that apart from this time issue, it is also to confirm the presence of the disease by means of biopsy or liquid biopsy. So in this sense, I think that in the future, most trials will have to confirm the relapse of the disease or persistence of the disease at 100% grade of being sure about that. Otherwise, we cannot take any important clinical decision.